Hello, everyone. My name is Jorge Zamora. I'm the quality analyst at Methodist Healthcare System. I support the quality department. I've been here for the past 2 years. Previously, I was in regulatory compliance for pharmaceuticals in Austin. In my current role, I support the quality department with the digital transformation projects, including creation of reports, dashboards, any electronic tools, process improvement, and providing data literacy education to the entire system. As a team, we support our 9 hospitals in providing quality and safe patient care while meeting our core metrics. I'm also the co-chair for our professional development of the South Texas HIMSS chapter and have presented this presentation at HIMSS Global Conference in March. Most recently, presented this work with the HAI reduction using a QR code with Microsoft for their bundle audits. So I have a bachelor's from UT Austin in biology, and I just completed my master's in this past December from the UT Health McWilliams School of Biomedical Informatics in Houston. I'm originally from South Texas, but enjoy spending time outside with my dogs and visiting family. Okay, let's take a deeper dive into this presentation. So healthcare-associated infections, the CAUTIs, catheter-associated urinary tract infection, and the central line-associated bloodstream infections, prevention using a QR code for bundle audits. So they play a significant role in patient outcomes. So we're always trying to see how we can get in front of that and provide better patient care. There's evidence-based practices suggesting that measuring compliance with a bundle intervention approach achieve greater reduction. The bundles consist of various steps determined by infection prevention team that includes like making sure the Foley catheter and the central lines are clean, labeled, changed out in an appropriate time. The bundle compliance is an all or nothing. So if one of them is missed, it compromises the whole process. So each component influences the decrease of the standardized infection ratio for the hospital. The current collection method that was being used was not very efficient and user-friendly, so the infection prevention team kind of approached me to see what ideas, what tools we can use to improve this and help them with their workflow and the front lines as well. In response, we kind of looked at Microsoft Forms since it was a tool that we already had, part of the whole Microsoft suite, and we found that the QR code was sufficient. You just kind of scan it. It has the questions in there. It's scan it with your mobile device, answer the questions, and then click submit. It was easy to streamline the process and get and match the nursing workflow. Once the data was submitted, it was instantly pushed into a SharePoint and then into the visualizations. So this was very efficient for the clinicians and put in their data, and we didn't have to purchase any new devices, any new software programs. The Power BI dashboards were close to real time, for allowing for data analysis and daily email reports that go out in the morning. So I mean, it's pretty close to real time. It did not put us also strain on the workflow since it was only just 5 audits per day, no matter how many patients were on the unit, kind of just a random sample to see how that unit was doing. Let's see. So with the CAUTI and CLABSI, the ease of the QR code made the rounding for staff and administrations as well very efficient to be on the floor and doing rounds and for part of that surveillance. Through the dashboard, we can see the overall compliance of the unit as well as the individual bundle components that will allow us now to see where we need to focus on and create different action plans. The tool was popular with staff, has helped reduce some APIs, and has inspired further innovation within the system. So let's take a little closer look at this poster. So like I mentioned, the previous tool was paper-based. There was an electronic tool, but we couldn't exactly extract the data and divide it by unit and the actual bundle components. the QR code, and these that you see on the screen, they're live, so you can scan them and play with them and see kind of what the same thing that our nurses and clinical staff is seeing. The components in there, they're all evidence-based. So if you look on any infection prevention or website, the bundle follows that same process. And like I said, it streamlines everything here. You can see from the user to the Microsoft Forms, the SQL Server, and then into the dashboard. Here we look closer at the results. It took about 2-3 months to get the full buy-in and utilization by like all the units pretty well. But you can see like by the second quarter, it starts taking off linearly, and by the fourth quarter, there's a lot of entries being made, and the compliance is also shows that it's been increased. So we have here the yellow graph here is for the central line associated bloodstream audits, and then the orange one here for the catheter associated or central lines that are being audited. So then the graph below that is the SIR rate, SIR, so the standardization infection ratio. And we can see here from 2021, the infection ratios, and then that line right there when we implemented the project, and you can see a steady decrease all the way to quarter one of 2023. So it's still a work in progress. It's been a year and a half, I want to say now, and the staff is really engaged with it and seeing how they can be there to provide the correct care for the central lines and Foley catheters. The graph here at the bottom has the pie graphs are the individual components in that bundle. So we can see like which steps are the ones that are having the fallouts. So now we can take a more narrow approach and see, okay, we need to focus on the labeling, or if they're not getting cleaned appropriately. So instead of just looking at the broader picture. So this has really helped our infection preventionists and the clinical staff look at their unit specifically and narrow the work and see how they're actually performing versus a bigger picture. On this other side, the kind of like the right side column, you see the smaller report here, which has the unit names. That is the daily email report that goes out, and it has how many bundle audits are completed for the previous 24 hours versus the number of lines that were in that unit. Like I said, we have a minimum of 5 for each unit. That far right column is if there were any that were missed for that unit. So we can see some of them had 2 that had to be completed and they were missed, so it's highlighted in red. Others that exceeded it or did their 5 or the minimum audits for that unit. So if they had 2 patients, of course you can only do 2. So those are not highlighted. That's good. And we continue measuring and each unit and see how we can support them. Okay. So in conclusion, this tool really helped streamline the technologies and seeing what we're using. We're being efficient of our resources and clinical staff's time to get real-time data and report for the reports and the dashboards. Audit submissions have increased. We've seen a good decrease in the catheter associated urinary tract infections, and central line associated bloodstream infections have decreased since we implemented this. With the work being done, there's better focus on our efforts, and now even the infection preventionists and the clinical staff have approached us with, hey, we like what we've been doing. We have these ideas for more innovation projects that we can do. Lastly, our limitations. So the SIR rate, we're only looking at our critical care units, critical care, med-surg, and tele units. So we still have that opportunity to look into all the units, but for now, those are our main focus. And then, of course, there is also the Hawthorne effect in the data submission. So since they know they're being looked at, there's a higher there's possibility for higher compliance rates than reality. So part of that monitoring the trends and not just implementing and keeping it hands off. So that's what we've been doing for our system for reducing HAIs. If you have any questions or suggestions, my email here is at the bottom. That's what we've been doing. Thank you.